Infusion and cancer care. A lot of things have come a long way in the last decade or more. We're going to learn a little bit more about some of those things today, as well as some strategies for lymphedema therapy. And my guests will include Letice Scott and Aaron Stanila, both here at Mile Bluff Medical Center. From the Mile Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Hey folks, welcome back to Wisconsin Doctors. We are here at Mile Bluff Medical Center. Today we're going to be learning a little bit about the cancer and infusion care services, as well as some lymphedema services that are offered here at Mile Bluff Medical Center. And I'm joined now from left to right, Aaron Stanila and Letice Scott. How are you?
Great.
Letice, welcome back. The second time on the program. Aaron, first time. Always good to have a newcomer with us. So let's start out by just kind of breaking the ice a little bit. And Aaron, why don't you tell us a little bit about what your role here is at Mile Bluff?
Yeah, absolutely. So I'm the nursing supervisor in the infusion and cancer care department here, and have been doing that for about a year. But before that, I was one of the infusion and chemotherapy nurses.
Okay, very good. And Letice?
I provide occupational therapy services here, both in the hospital setting, outpatient setting as well, and I'm also the certified lymphedema therapist at the hospital.
Good to know. So we have a couple of experts here, which is what we always hope for. So talk a little bit about the infusion and cancer care side of things. What services do you guys provide?
Yeah, so we actually have three different kind of service lines through our department. One is actually a newer service that we've provided, which is wound care, which I think our wound care nurse will be here next month actually to give you a little more information about that. But the other services are the cancer part of it, which is we do outpatient chemotherapy, either through IVs or injections. And then we also do the infusion part of it, which is providing other medications for things like rheumatoid arthritis, multiple sclerosis, doing outpatient blood transfusions, allergy desensitization injections. I mean, kind of you name it and we do it.
Sure, you have a wide variety of services. Yeah. Let's talk a little bit about the chemotherapy side of things. Are there any restrictions on the chemotherapy that's provided here at Mile Bluff Medical Center?
There are a couple. In general, we don't provide chemotherapy for children, so your pediatric patients.
Sure.
We also don't do inpatient. All of our services are outpatient, so if it's something where you have to be staying in the hospital while you're receiving treatment, we don't do that here. And then we don't do any trials. However, going back to the pediatric patients, we do things like lab draws, fluids, stuff like that, so kind of those supportive care things through our department. Just not the actual chemotherapy.
Gotcha. And let's talk about some of the other cancer-related services that you have here at Mile Bluff Medical Center.
Yeah, so we actually provide a pretty wide variety, a pretty comprehensive approach, I guess, to it. We have oncologists that come from UW to see patients here locally. We also have our imaging department where patients can get, their CTs, PET scans, those sorts of things to monitor. We do labs, obviously.
Right.
Surgery. There's nutritional services, social services really helps our patients with things like managing, wills, DNRs, that sort of thing. And then through our PT and OT department, people can get rehab and things like the lymphedema therapy that Letice does.
Yeah, absolutely. And let's kind of segue into that. What exactly is lymphedema? Because that's one of our topics today.
Lymphedema is the accumulation of excess water and proteins in the tissues. Usually, to be considered lymphedema, it has to be chronic. Usually that's 3 months or more of swelling. There also needs to be some skin changes to the tissues, like hardening of the tissues, stuff like different things like that. And then, excuse me. And Usually it's got to be a disruption, to the
Sure.
lymphatic system.
Okay.
Like an example, kind of going back to the cancer, would be someone who has a mastectomy done. They might also have some of their lymph nodes removed. So that
Oh,
would
okay.
cause the lymphatic system to get disrupted.
Okay.
And then they would see me.
So like the swelling and everything that you talked about, it may or may not have an effect on the lymphatic system. Is that the case, or does it always have an effect on the lymphatic system?
It varies, honestly, patient to patient. It doesn't mean that you're always going to have a problem, but
Okay.
some people do, truly.
Okay, gotcha. We're going to talk a little bit more about that after the break here at Mile Bluff Medical Center. We're going to continue talking about lymphedema services as well as other cancer and infusion care services here at Mile Bluff. We'll be right back with more Wisconsin Doctors. Welcome back. We're here at Mile Bluff Medical Center for our show, Wisconsin Doctors Today, and we've been talking about infusion and cancer care. And when we left off, we talked a little bit about lymphedema care. Actually, we just sort of defined lymphedema. We haven't really talked about the care yet. We talked about what it is, and it has to be something that affects the lymphatic system. So let's talk about who is your best candidate for lymphedema therapy.
Usually a patient who's had swelling, be it in their legs, their arms, I mean, people can even have swelling in their face, honestly,
Okay.
Anywhere, and it's been going on for some time. Even a patient who say they've had swelling for decades, they
Wow.
can still come in and be treated. It doesn't mean that just because you've been living with it for 10 plus years that, oh, sorry, there's nothing we can do. Like, no, that's not the case.
Okay,
like,
wow.
definitely come in and, see if there's something that we can do for you. So I would say anybody who has any kind of swelling, like, we can definitely try to get them better so that they can function at home better.
Do you find that people often think that? It's like, well, I've had this for a decade now, there's probably nothing that can be done.
I hear that with a lot of my patients, honestly. I think the doctors usually tell them, like, well, just go try it, see what happens. And
Sure.
then they're always surprised when they lose some fluid and,
Wow.
and relieved at the same time.
That's fantastic.
Yeah,
I would have
is.
thought it would be the other way around, that people who maybe just have it for a brief period of time say, oh, I don't need to go and do this because it'll go away on its own.
And I get that a lot
You
too,
get that too.
honestly. And then when they come to see me, they're like, it's not really going away. And it's like, okay, well, let's see what we can do and
Sure.
try to get them better.
So let's talk a little bit about what the actual treatment is. What does that look like? What does a treatment look like for somebody with lymphedema?
Just a standard treatment, like, no complications or anything. Usually it involves compression wrapping.
Okay.
That I would try to do with them about 3 times a week.
Okay.
Because usually you have to have that frequent wrapping there.
Sure.
There's a manual massage technique that I use to help the lymphatic system drain.
Okay.
I also teach people how to do that at home too, and then exercise.
Sure.
Yeah, honestly, your muscles are going to be responsible for a lot of that lymphatic transport. So the more exercise that people can do, usually the better.
Yeah. And what kind of exercise do you typically recommend? I mean, does it depend on the patient? Is it just a matter of walking and getting out and moving?
Walking is great, honestly, especially for someone who has swelling in their legs.
Sure.
But it really does depend on the patient and where the swelling is located. But I think people would be pleasantly surprised. I'm not going to have them doing jumping jacks or anything like
Right.
that. Like, it's fairly reasonable exercises for them to
Right.
do.
That's good to know. So now, what about the duration of their treatment? Because I'm sure it varies based on the patient and how severe the lymphedema is. But what is the typical duration that we're seeing?
Usually for one session, you're looking at anywhere from 30 minutes to an hour of the treatment, just because between
Okay.
the wrapping and the massage and going over their program, that can take an hour.
Okay.
Some patients, though, are not that complex, so then it might just be a half hour where they're coming. And then I usually see people, I would say a minimum of at least 4 weeks.
Okay.
And then I've seen people for as long as 4 months. But again, that depends on how complicated
Sure.
their swelling is and how chronic it is, and just trying to, get them as far down with their swelling as we
Yeah.
possibly can.
So about an hour 3 times a week, it sounds like, and then maybe for starting out at 4 weeks minimum typically is
Yeah.
what we're looking at. Okay, good to know. Erin, let's talk a little bit about some of the other support services that are available when it comes to cancer care here in the area.
Yeah. So besides being able to do the lymphatic therapy and the chemotherapy like we talked about, Mile Bluff also provides a cancer support group right here. We also do a program called Look Good, Feel Better, which is actually through the American Cancer Society, but we provide kind of the coordination and the site for that. And that's where women who are actively going through chemotherapy treatment can come and have a consultation with a beautician to talk about like skin changes and makeup tips and you know, scarves and hats and stuff like that.
Sure.
So there's always that. There's also a another foundation, I guess, within the area called the Friends and Family Foundation, and they provide additional like monetary support for patients that live within certain counties.
Sure.
But they provide stuff like, you know, quick trip gas cards, stuff like that. You know, there's a lot of travel.
Sure, yeah.
You know, sometimes
if they've got to travel from outside the area to come and get their treatments here and so forth. That's nice that they have that option of having that provided for them. So I'm actually going to jump ahead just a little bit here and ask you, Erin, let's talk a little bit about, actually we're going to go to break. Just looked at the clock, we're going to go to break here. We'll be right back. We'll talk about some changes in chemotherapy when we come back here at Bluff Medical Center. Stick around. We're back here at Bluff Medical Center, and we're talking about cancer and infusion care and also some therapy for lymphedema. I want to talk a little bit about chemotherapy again because when we were going to talk about this before the break, we ran out of time in the last segment. What sorts of changes have we seen in chemotherapy over the past years, decades, whatever? How has that changed?
Yeah, so one of the things that we've seen change is one, there's better symptom or side effect management. You know, we've come. Sorry.
That's probably the best way to look at it, though, is because, you know, when people think of chemotherapy, they often think of, oh my God, what are all the side effects? What am I going to be going through after my chemo? And so that probably is a huge advance if you can do anything to mitigate those side effects, I would imagine.
Yeah, absolutely. And that's one question that I get a lot from patients who are just starting is, you know, hey, my grandma did this 20 years ago and you know, she felt awful, you know, am I going to expect that same thing?
Right.
You know, and we really do have just, you know, more things that we can do to help combat those side effects so that we can make it as easy as possible for you.
Right, yeah. People want to still be able to live their lives as much as they can, you know.
Absolutely.
So that makes sense. Let's talk about immunotherapy. I'm not as familiar with immunotherapy. What exactly is that?
Yeah, so immunotherapy is also another treatment that we've seen more often. So, and it's actually a type of cancer treatment that works with your body's own immune system to kind of boost it so that your body's natural defenses can kind of fight off the cancer.
Sure.
And we're seeing that become more popular and more, you know, it's getting approved for more and more diagnoses and either by itself or in combination with your traditional chemotherapy.
Okay, so it can work by itself or hand in hand.
Yeah, and there's just different side effects. You know, you don't have those kind of more classic chemotherapy side effects.
Sure. Are they just different? Are they less severe typically? I mean, what are you finding as far as side effects go with immunotherapy?
Different. So it's more certain lung infections, certain colon infections, those sorts of things. So it's more targeted, less systemic.
Right. So depending on what your case is, one might be a better fit over the other for the individual patient. So, what are you finding are the end results of? I mean, are people? What are the end results of people, you know, seeking some of these treatments that we've talked about today?
Yeah. So I mean, it all varies. I mean, chemotherapy has different goals. Right. So for some patients, it's a curative goal. Sure. You know, for other patients, it's to give better quality of life, manage the disease itself better, or to prolong life. So it really depends on what it is we're dealing with, what diagnosis.
And then Latice, what about, same question for you, because we talked in an earlier segment, we talked about some of the lymphedema treatments that you offer here. What are the end results that you're seeing with your patients?
We definitely hope to reduce the swelling in, whether it be in their legs or their arms, and then also set up kind of a long-term plan for them, for whether it be the compression stockings, the massage, like just whatever is going to work with their lifestyle. That's usually the ultimate goal too.
Are people finding that they're getting a big piece of their lifestyles back that they have been maybe missing for the last 10 years or more?
Yes, I have a lot of people, especially if they have had like really chronic swelling in their legs and their legs are just so heavy. Like once we get some of that swelling out of there, they'll tell me, I'm walking better.
Right.
Like I'm better, I can walk further and longer. And they're just so thrilled with that, because like you said, they're getting some of their lives back. And that's going to be really great for them.
Absolutely. Lots to be grateful for there. We're going to take a short break. When we come back, we're going to talk a little bit about changes to outpatient services and kind of wrap up this topic here today at Mile Bluff Medical Center. We'll be right back with more Wisconsin doctors after the break. And welcome back to Wisconsin Doctors. We're here at Mile Bluff Medical Center. We've been discussing infusion and cancer care and also some lymphedema therapies as well. I want to try to wrap this up a little bit. The chemotherapy and the cancer treatments that you offer are all outpatient services. What changes have we seen recently to outpatient services, Erin?
Yeah, so healthcare in general, we're seeing an increase in outpatient services. Hospitalization stays are shorter. It used to be people would come in for, say, a cellulitis, and they'd stay, they'd be admitted, stay, and get their antibiotics, for a week afterwards. We're not seeing that anymore. You're in the hospital for a couple of days to get you stable, and then you come to us and get your IV antibiotics outpatient. And that way you can be at home recovering in your own home, which, they show it tends to work better.
Right.
So surgeries, same thing. You're seeing more and more outpatient surgeries versus people having to stay overnight for certain procedures. So we've definitely seen an increase, in the department just based off of that.
Right.
And then another thing that we have seen is also an increase in our wound care services as well, which, like I said, Angie will be here next month to talk about that a little bit more.
Yeah, absolutely. So what are the benefits of patients are finding by being treated locally here in Mauston?
Yeah, so one of the things that I hear a lot is just they're so thankful that they don't have to drive. There are a lot of appointments that go into this. You have to come in and get imaging, and come in and get labs, and then treatments. And treatments are all a little different, a little varied. You could be coming in once every other week. You could be coming in every day for 7 days, once a month. So that varies. So it just saves not only it saves that time.
It saves that time. And money and gas.
Yeah, absolutely. Which is a big thing. I mean, you want to be able to live your life as normally as possible.
Of course, yeah.
And spending an hour and a half, 2 hours in the car one way is difficult when you're trying to do that.
If we can prolong and give you more quantity of life, it should be good quality life too.
Yeah,
so, Letice, what about you? What are your patients saying? Same sort of thing?
They're kind of saying the same thing, because if you got to come in for lymphedema anyway and be wrapped 3 times a week, you don't want to have to drive an hour and a half just one way, to go in and be treated for an hour, and then you got an hour and a half drive back. And then if you are getting cancer and if you are getting cancer treatments too, you have that going on. And so it's really nice that they're able, I have patients tell me all the time, they're so grateful that they have somewhere close that they can come and get wrapped. And same with even our regular rehab services, like with physical therapy too. We have a great team here where they can help them get stronger, just really work with them so that they don't have to drive so far.
That's awesome. And you had a story that you wanted to tell about how a patient that you helped recently.
Yeah. So she hadn't had the lymphedema services for about 20 years. She'd kind of given up.
Yeah.
And then just thought, why not? Anyway, when I started working with her, she ended up, I reduced her one leg below the knee, keep in mind, and by 13 inches.
Wow.
And I mean, it was just life-changing, increased mobility, just so appreciative that she didn't have to drive so far to get that taken care of. And yeah, it was pretty amazing.
That's awesome. And then, Erin, you had a story as well that you wanted to share.
Well, I guess not necessarily a specific story, but more one of my favorite things. One of the my best days are when I see patients come back to us who have done their treatments, they've completed, been deemed cancer-free, and then they still come back to visit, and we get to see how they're doing, and I don't know, it's really great to see that, and they are, again, so appreciative of the fact that they've been able to do this here locally, not only because of the driving like we had already talked about, but also I hear patients say a lot that they're thankful that they were able to kind of get everything in one spot. Whether, that we were able to kind of coordinate everything through one facility. So whether it's appointments with their regular doctor and the oncologist and the imaging and lymphedema therapy and the nutritionist, kind of everything in one area.
And you really get to be a part of the community here. The great community of Greater Mauston, shall we say.
Yes. I love getting to see my patients out in the community.
Outside of
Grocery store, out at the fall festival, everywhere.
That's fantastic. Well, Erin Stanila and Letice Scott, thank you so much for being with us here today. We appreciate all the information. And that is all the time we have for Wisconsin Doctors. From all of us here at Bluff Medical Center in Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.